Hello and welcome everyone to VIE Healthcare's LinkedIn Live first broadcast on taking a data-driven approach to purchase services management. So bear with us. It's the first time we're doing this. So we're hoping that we give you some great information and have an interesting discussion. And if you've got questions, please send us questions and we'll do our best to answer. So we want to start today, Rich, and kind of talk about cost savings in purchase services. And then we're going to move to, I think, the bigger topic that's less spoken about, which is the actual management and cost control of purchase services. So, we were having a discussion today about purchase services cost savings and just kind of the three elements of really being able to achieve all the cost savings possible. And I think the number one aspect is really understanding your spend as a whole.
Absolutely. And hello, everyone. And the first thing you would want to do is really to first go to the bigger picture of what vendors you have, what spend you have, and then really start to drill down into the specific categories and different areas of services in different departments. But really, from a high level, really start from that point and then move lower.
Right. I think that the second part is it's a bit of a practical or tactical and somewhat of a strategic approach, which is to what's coming for renewal in the next 12 to 24 months. Those things obviously have to get done. So you've got to look at those purchase service agreements, have enough time to prepare. But I would also encourage everybody to jump into something maybe that you've never done before. Look at an area of spend that might be a little bit uncomfortable, maybe legal or some clinical areas, and just start, going beyond your comfort zone, maybe a little bit of skill set, and acquire those skills or collaborate. But looking at other areas that typically go renewed, or maybe they're not looked at. Things that, again, I would make the argument that legal expenses are a great area to look at. Could you do you know how many legal firms your hospital has, at what hourly rates, all the miscellaneous charges? So do something a little out of your comfort zone is kind of our point number 2 for cost savings.
Right, absolutely. And really just to that point as well, I mean, there's a lot of areas that, specifically in the supply chain and finance that, other departments, they're just not willing to or have not been willing to share in the past. But obviously with a lot of the health systems being integrated now, more centralized, those questions and the question on specific vendors are really coming to the forefront. So, obviously facilities is one area that, there's a lot of professional services, a lot of regional and local vendors that are providing services to the organization. And, what does that look like as far as their cost structure when you compare one region to another? Another area that really, outside of, we're talking about legal and facilities, but from the clinical purchase services as well, and really trying to understand what vendors are servicing these outsourced agreements for the hospital and for the health system, and really how do they integrate into the entire system.
And I think the third area is also very key, is understanding your resources, both your internal resources and those external resources that you may need to utilize. Obviously, building your bench and building the capabilities internally is always so important. And then there may be times that you want to reach out just to accelerate those goals, or for specific resources or skill sets, and getting the experience, because in fact experience matters in purchase services spend. Really understanding the nuances in some of these areas can make a big difference. And the other aspect of resources, which we're going to talk a little bit about, is the ability to get to those line item details as you're having the cost savings projects. So that's, the real focus of this LinkedIn Live broadcast, is to talk about a data-driven approach to purchase services. And so, anything you're doing, whether it's an RFP, or supporting value analysis, your ability to get to those invoice line item details is so important. Remember, services are performed and then invoiced. So that record of detail of your utilization is not in a materials management system. It is on all your invoices. It's embedded on all your invoices. So it isn't a good practice to spot check or use top spend items or use 1 month of data to perform an RFP or to support any kind of initiatives. You need the line item details from your services spend for the last 12 months of your historical spend. That will give you the true utilization. It's very similar to how you would look at supply chain in terms of supply costs. And purchase services requires that same discipline of looking at the line item service details.
Really, when you start to about cost structure of an agreement, specifically with someone like a physician or a clinician that really wants to understand that wants to understand the bottom line cost, but really having those line item details gives you the power to be able to really show the opportunity, not just, like you said, a high level, and really give them the comfort level that you know what you're doing, you know what you're talking about. Because I think we've all been in a situation where there's one number off on a specific agreement or the analysis based on the agreement, and it really impacts the way that the discussions go. If there's an ability to negotiate to the best pricing, so it really, the data-driven analytics is really critical to get to the best pricing, to get to the best contract, because it's the core and the root of the entire initiative.
Absolutely. So we'd encourage you, to seek out. I think the resource that most organizations need the most is the ability to get to the line item details. And so I can't overemphasize that all of these cost savings initiatives, whether you're using an aggregate categorization or an RFP online tool or whatever you may be using, if you don't have access to line item details and you don't have the ability to go back and look at every single service spend for 12 months, you are missing cost savings opportunities, because the details, the opportunities will sit in those, in those line item service details. So I want to move to this topic that we talk a lot about, but I think it's the missed opportunity. And we say it often. Everyone's looking at cost savings, and listen, there is tremendous amount of cost savings. We support hospitals every single day on these purchase services cost savings. So there's lots of them to be had, and how you go about it is so important. The bigger discussion is around cost management. And I always kind of talk about 3 different areas. It's be able to centralize, consolidate, and control. And, first and foremost, it's the ability to centralize all this spend and even have a vice president of purchase services management, and be able to have every single dollar vendor centralized in one department is critical to the success. So that's number one.
And just a little more clarity too. And typically when you're in the historical, view of purchase services, the department managers would be the ones that own the contract. They would negotiate the contract, and then they would put it in their drawer, and supply chain finance would never see it. Obviously now that's being more and more driven centrally, but at the same time, it's still providing the same oversight from the departments, right? So it's not necessarily where it's taken away from the departments. It's now the departments are being better serviced by supply chain, by finance, all the necessary avenues to be able to review, make sure the contract's correct, make sure all the things that are what have been agreed to in the contract is done and are being performed accurately. And really, from an organization standpoint, if there's no silos, in which obviously would support the entire function of the agreement.
Right. And the second part of that is the ability to consolidate, right? And we talk a lot about consolidation tools to, again, understand different vendors providing the same service in that consolidation. But at the end of the day, in order to actually have a consolidation approach, you need a line item detail approach, right? How many times have you and I worked together to see a health system use 2 or 3 different vendors for the same service, and the structures and how they price are so different. And a lot of assumptions are made, well, this vendor is actually less expensive. And then when we go ahead and look at the line item details, we find out the opposite, because surcharges have added into the cost. So there's all these different reasons why that what appears to be one way, in fact, isn't. And it was only because of the line item details, in fact, that uncovered the true story, the true cost. So really the ability, to consolidate is so important, but your approach to consolidation, your methodology and discipline around that is very key.
One example that we're currently active with a few of our clients is in food and nutrition services, and again, based on the growing health systems and the different vendor partners that are servicing these different health systems, you're going to have situations where you're going to have multiple vendors supporting your organization. And really, how do you understand which one is providing the best, not only the service, but also the best cost structure? Typically, people look at the procurement credit, so how many rebates you get back, and then there's always the supplies that are obviously pretty straightforward. Can we do this better? Can we get a better discount? But there's other things that are embedded in these agreements that really need to be reviewed. And again, it goes to the line item details. And one is the fringe rates, to understand where the fringe rates are, and you can see different companies do it differently. You also look at the insurances, and a lot of times the insurances are embedded into these what they call administrative fees. So administrative costs within the contracts are typically this little pool of cost money that don't have any details behind it. Mm-hmm. So you always want to make sure what that is and have that broken out, because again, one vendor does it differently than another vendor. So you really need to understand, have that experience to really ask the correct and appropriate questions to be able to break that out. Other things that go along, like pouring rights, right? So if they're purchasing the Coke or Pepsi or whoever would be coming through, these vendors have national agreements and they get back end rebates. Now, if you decide to contract separately, you actually would have a better agreement, not only better pricing, but you get the rebates in the back end. So it's always important to understand how the pouring rights, the Coke, Pepsi, et cetera, and then also the microfiber programs as well. So how does that, from the cleaning aspect to other things that go through, depending on the integration of the services, typically with environmental services and food and nutrition services, how the management structure is built as well. So not only just the management cost, but also the actual managers and how many FTEs are associated with that. So there's a lot of things that are embedded in these agreements, and when you look to compare one to another across the health system, it's really eye-opening.
And that's a great example, because so much of that gets missed in that it's that administrative bucket.
Yeah.
So many things gets thrown in there. And so for everybody out there, go to their agreement, go to your invoices and look at administrative costs, because it'll be very eye-opening to dig down into that area. It's a great example, Rich. Thank you. And then the final area is control. Ultimately, at the end of the day, how we control purchase services spend is really so foundational. We need a whole new way of thinking and disciplined approach to really controlling this area of spend. And what happens is that everyone negotiates a great agreement. It's taken a lot of work to get it to where it needs to be, and we get the agreement in place. And cost savings are being achieved, but then the discipline of controlling those costs or managing to those costs on a monthly basis doesn't happen. And there's a real reason why. It's not anyone's fault. The real reason why is because you have hundreds or thousands of pages of invoices that come in. These department directors, from support services to lab, there's clinical, all over the hospital, department leaders are being asked to review and manage their department from purchase services invoices. And the line item is absolutely impossible. It's just, it's statistically impossible for that to happen. So this whole new approach around cost management or controlling cost has to be looked at. And how are you doing that internally? Do you have a way to get those line item details and have an approach to understand what's going on, compare if you're a system with one another, and maybe see really important trends like linen loss as it's happening versus maybe 9 months, 12 months later in retrospect a problem, or a pricing error that happens for whatever reason And then when the contract's renewed, then everyone's kind of going back and looking, and maybe that's identified, and then saying, oh, we missed it. But these are all the things that eat away at the cost savings. And I hear all the time, we've been doing this for over 20 years, and we hear all the time, well, we really didn't get the cost savings we thought we were going to get. And as we look back, we say, okay, well, it's because of this, and ultimately, it's because a cost control process has not been put in place.
Yeah, we have a recent client that asked us to help monitor their monthly reference testing. And just to give an idea of how large this is, it's 6,000 line items a month, and it's over $800,000 a month. Mm-hmm. So that's what this manager is required, or really responsibility to manage your budget. It's to look through 6,000 line items trapped on invoices, which is absolutely impossible.
And to look at trends, and to say, okay, well, is everything on contract? Is there pricing errors, or are there tests that maybe we can move in-house because we have such a volume? But you can't do it. It's impossible to do it from an invoice basis.
Right, absolutely. So how do you know, like you said, if there's all of a sudden there's a new kind of test volume increase, you've negotiated your contract, like you said, we didn't see the cost savings that, we expected. And a lot of times as the behavior changes, the course changes within the time period. So if it's 2 or 3 year contract, 6 to 8 months into the agreement, a little different pattern develops, and you won't see that until the end of the 3 years. Instead of seeing it monthly, which is really what should happen.
Yeah, absolutely. So, we have a few more examples to share with you, and I don't know if anyone has any questions. Although I wouldn't know if how they would come across, even if we did at this point. So, but please leave questions in the comment section, and we promise to get back to you on those questions. We work with hospitals to help them manage and automate their purchase service spend, to give them a true purchase service spend strategy. And that spend strategy has always been rooted in the line item details. And so we have a very effective and patented approach and technology that gets to the invoice line item details, that reconciles to your agreements. And it gives you the trends on a monthly basis, so you can operate, manage, and really not only continue, your cost savings, but control and pick up things and really take cost savings to a new level. Make sure that, we often say, protect your cost savings, right? The only way to do that is to the invoice line item details. And so if you'd like to learn about our management and automation purchase services approach and our patented technology, please reach out to me. We've had a lot of hospitals that are very excited and are doing a great job at a new discipline, a new level of management. Once those contracts are in place, now they're really able to keep those cost savings and giving their department leaders, like you said, the ability to manage their budget, because it's very difficult to manage from an invoice. Do you want to talk about another example? I think we have a couple more that teed up.
Well, one of the other ones that is a common source of frustration is in the biomed and biomed engineering and the invoices and how they come through, and then matching those back up. We have one client who just ran the numbers. It was 3,700 line items over a year, about $1 million spend, and really trying to manage that, where it's the full services with parts. Is it correct? Is the pricing correct, not only on the parts, but is it covered? What's not covered? And then what really came out of this one analysis that we performed was physical damage, where they had one hospital within the system that had a very high rate of physical damage compared to the other facilities. And when they went to investigate, it really shouldn't have been. It was basically the same type of service, and it should have been covered, but it was buried into the analysis or into the invoices and wasn't identified until we really pulled out and started looking at it.
And that's a really great example, because you can't see it. Some of those invoices are 3 and 4 pages, just as documentation for the repairs. We had another instance where there was patient statement accounts that it was embedded in a larger agreement, and because it came through and they did have the service, it was paid. But we started going through the invoices and looked at the details, we actually picked up that they were being charged triple, not even double. And it was a big cost savings. It was even a larger credit. And I think the biggest message we're trying to share today is that, yes, there's a lot of cost savings to be had in purchase services spend. There's just so many untapped areas. And, getting to those pricing, the structure, all those things are still lots of opportunities. However, if we don't, as an industry, start moving towards a disciplined approach around cost control and cost management, we're just going to go in this cycle and getting back to where we were to the beginning of the agreement. And so this whole new approach on managing the service spend on a line item basis and actually having a dashboard that has the line item details, right? So wouldn't it be great to see in a line item basis, again, we'll go back to legal hourly spend, professional services spend, whether it's biomed spend, anything that you can think about from a line item detail from a purchase service spend. Wouldn't it be extraordinary to map those out every single month on a line item basis and see, just like you would on your supply spend, what those trends are and what's going on?
Absolutely. And recent, regulated medical waste is another area that a lot of people have a lot of frustration with. And it's one where when you look, for this one example, when you look at categorizing spend, which is very directional, it's very good to understand. Again, when we first step is to understand what costs you have and the vendors you have, but it has its limitations. And we had a recent example where if you looked at the spend for over the course of this 6-month period that we did the analysis for, the pricing, the total cost was decreasing. So someone would look at it from a high level standpoint and say, we must be doing good here. Right,
because they had a dip. So if you're looking at categorization, it's like January, February, March, and it's got the dip. You're like, wow, we're doing a great job.
Right, exactly. So if someone came in and looked at it and said, oh, your metrics, you're here per bed, you're doing great. You're in one of the 90th percentile for being above board. And but when you looked at the line item details, there was hidden costs in there that you weren't, because the spend was so large that little blips in it wouldn't be seen. So it was a $34,000 one-time error that was in the invoices. But unless you went through the invoices and extracted that information, it would have been completely missed.
Right, and we often go back to that example because if you trended that out 12, 24 months, in fact, that was the month that had it had dipped. And so while categorization is a nice thing, to have. Anyone can take an AP spend report, kind of put it into Excel, and you can visualize it. We think that's great. Everything you're going to do and need to do is going to have to come back to the line item details. And so we thank you today, for joining us on our first LinkedIn Live. We're going to be doing this quite often, and we're going to get better at answering questions. So if you did ask questions, in the comments section, we will get back to you, and look forward to talking with those who are interested in learning more about VIE's patented invoice ROI technology. It's the only technology and the only approach to get to the purchase services in invoice line item details. So thank you, everyone.